Everyone, and welcome to this edition of the Global PAD Impact Awards presented by the Global PAD Association. This prestigious event celebrates outstanding contributions to peripheral artery disease awareness and patient care. Today, we are announcing the Best PAD Awareness Campaign. Now, the criteria for this award focused on innovative campaigns that significantly increased public awareness of PAD, improved patient outcomes, and demonstrated a collaborative approach across multiple healthcare societies. We are thrilled to announce that this year's winner is the multi-society supported Get a Pulse on PAD campaign, led by the Society for Cardiovascular Angiography and Interventions, or SCI. This groundbreaking initiative has made remarkable strides in educating the public about the risk factors and potential symptoms of PAD. The Get a Pulse on PAD campaign has been instrumental in reaching underserved communities and populations disproportionately affected by PAD. And since its official launch, physician spokespeople from SCI and partner organizations have been featured in hundreds of broadcast interviews across local and national press throughout the United States. The campaign's success lies in its comprehensive approach, providing resources for both healthcare professionals and patients alike. These include step-by-step guides for understanding risks, recognizing symptoms, and determining appropriate treatments. The campaign has also leveraged digital platforms, creating a dedicated website, padpulse.org, and utilizing social media to amplify its message. To receive the award and share insights on the evolution of the campaign and its impact, we are honored to have with us two distinguished interventional cardiologists, Dr. Andrew Klein from the Piedmont Heart Institute, specializing in interventional cardiology, vascular and endovascular medicine. Also, we have Dr. Eric Sizemski, Director of Vascular Intervention in the Cardiovascular Institute at Beth Israel Deaconess Medical Center and Associate Professor of Medicine at Harvard Medical School in Massachusetts. Both are contributors to the Get a Pulse on PAD campaign and SCI members as well. So a big welcome to you both and a big congratulations for contributing to such a successful campaign. Thank you so much for all you do to save life and limb. And a big welcome again.
Thank you.
Thank you, Kim.
Thank you. So excited. I think we should get started. Maybe we'll start, Dr. Sizemski, could you please just introduce yourself and your role with SCI, and then we'll jump to Dr. Klein to do the same.
Absolutely. I'm Eric Sizemski. I'm a interventional cardiologist, as mentioned, in Boston, Massachusetts. I primarily practice at the Beth Israel Deaconess Medical Center, where I'm the Director of Vascular Intervention, and I run a research center, a section within it called the Interventional Cardiology and Vascular Research Center at the Smith Center, and part of that is through my affiliation with Harvard Medical School. And I have a very diverse practice, and I'm lucky to be involved with SCI for several years now, and I'm currently serving as the co-chair of the Vascular Disease Council for SCI.
Fantastic. Well, thank you for joining us. And Dr. Klein?
Yes, thank you, Kim. I'm Drew Klein, one of the interventional cardiologists and vascular medicine specialists here at Piedmont Heart in Atlanta. I've been involved with SCI since I was a fellow many moons ago and currently serve on their board of trustees. I was the former chair of the Vascular Disease Council and worked very closely with Eric and a whole group of phenomenal SCI staff in trying to get out the awareness regarding this devastating disease. So thank you very much for the opportunity.
Well, let's, just in general, before we get into the entire, just specifically on the campaign, both of you practice, with PAD patients and have been involved in their care for a very long time. In general, what have you seen individually in terms of the problem with PAD?
Yeah, maybe I'll start and I'll hand it to Drew. I think, like, for me, the biggest awakening in my practice was how everybody knew what a heart attack was and no one knew what PAD was. And I can't say, I think it's gotten better among subset of populations and patients, but it just speaks to two things. One is how remarkable we did at broadcasting what heart attacks were to the lay press and lay people, common, see it on TV shows and news, and everybody became incredibly familiar with that. And we never extended it to other really severe kind of parallel disorders. Stroke is probably number two that people know kind of at least the basics of stroke, but people seem to be lost with peripheral artery disease. So I think that starting, if you want to go bottom up, starting with the education efforts outside of even inside the medical community, but particularly outside the medical community, I think is an area where it's just put us back much further than where we are with cardiovascular care and coronary care. Sorry, Drew.
And
I'm sorry.
Dr. Klein, what do you think that if we changed PAD and just called it a leg attack, do you think that it would make a difference?
Perhaps, and maybe dovetail off of what Eric said here, is that really we have a great educational efforts in other specialties and other disease states, but PAD has more aspects and more issues with access to care and disparate populations and very vulnerable populations. And I think the key thing for PAD is accessing and educating, getting the word out. Very similar to what was done with the hypertension or barbershop study, and really reaching populations that do not know that actually PAD exists. And I can't tell you the number of patients that have had ulcers that have been present for years, and oh, it's a diabetic ulcer, it's a pressure ulcer, and really it's a PAD ulcer. And how many people have undergone unnecessary amputations because of it? And so really reaching out and saying, let's get to the bottom here, because this is not just an issue with U.S. population, but really an issue with focusing and targeting vulnerable populations, also socioeconomically and racially as well.
And we're going to start with you on this one, Dr. Klein, since you were talking about especially the patients with ulcers that were being misdiagnosed, and they should have been diagnosed with something involving PAD and had their vascular evaluation. Share a very, very specific patient in which you couldn't believe that they didn't get diagnosed in a timely fashion, and it still haunts you today, and is actually representative of one of a set of patients who got missed, and you just don't understand why.
So unfortunately, the number of patients that I know that have been there have been incredible. In fact, I actually have one patient, thankfully is more of a success story, underwent revascularization, had an attempted revascularization in an outside hospital in Virginia. She's an African-American female, had an ulcer for almost a year, and then was seen by a specialist, thankfully, after an entire year. Underwent one bypass, it failed, underwent a second attempted bypass, it failed, and was told the only option for her is an amputation. She came down here to Atlanta to see her son. She ended up, I don't know how, in my practice. We were able to revascularize her leg, and to this day, she's doing quite well, walking, no amputation, no pain, ulcer is completely healed, and is feeling wonderful. But balance that success story with many, many people that just basically, plenty that have had both legs amputated above the knee because they just came in too late. They really left it till the wounds are to the point where there is no other option, either an amputation. So success balanced with lots of failures that go out there.
Yep, definitely. What about you, Dr. Sezemski?
I think, my most impactful story as a physician was one of my first patients I had ever met. It was referred to me right when I started my practice, and I developed our vascular intervention program. And he had a bypass about 10 years ago, fell out of care, and came into clinic with walking with a cane and saying that his foot was numb. He had been seeing many doctors through the years, and we're all told that it was neuropathy related to his diabetes. And we did some basic vascular studies and knew within minutes that his distal to his graft was completely occluded. And he unfortunately was so immobilized from his condition. He picked up some bad habits. He was drinking more than he should be. He was still smoking. He had stopped for a while. He was having struggles at work. We were able to get him into the lab in a timely way. The procedure took an hour. He felt almost 100% better afterwards, no longer needing a cane, foot feeling, full of life. And, I've seen him now in follow-up for 7+ years, and he doesn't drink anymore. He doesn't smoke anymore. He finished his career, he retired, and now he goes on cruises. So every time he sees me, he comes in with a different Hawaiian shirt and a postcard of where he went. So, to start your career with that type of story and patient, only feeds the motivation to want to really, dedicate your career and your life to helping with this disorder.
Yeah, that's a beautiful story. And maybe he'll bring you one of the Hawaiian shirts one of these times.
Yeah, I get the postcard. I got to upgrade to the Hawaiian shirt now. Yeah.
Exactly. So I almost feel like this is a rhetorical question because your explanations were so powerful, and we really get the fact that these patients are coming to both of you as PAD specialists way too late. And it just is so frustrating. So I imagine that was one of the impetus for Sky to create the Get a Pulse on Pad campaign, right?
That's correct. I think, if you look at the amputation rate amongst Blacks and amongst Hispanics, it's 4 to 5 times higher. We really need to get the word out and really address this at every level. So not just across all populations, but especially focusing in on the vulnerable populations that, really do end up coming in too late. And so getting that information, I think one of the most powerful examples of this, and Eric and I know him well as a colleague of ours named Feluso Faccaretti, who was very instrumental in this campaign. Feluso opened up a center in the middle of Mississippi and cut the amputation rate in his town by almost 50%, just single-handedly. So it's out there. Let's get the information. He's really making a big difference in this small community. And what we really need to do is raise the awareness amongst patients, but also around physicians, because unfortunately, and I'm sure Eric had a different experience, but for me, I made it through an entire internal medicine residency and never even got education about PAD. So we really need to talk to the doctors as well. So really raising awareness at all levels.
Yeah, definitely. Dr. Sazemski?
Yeah, I mean, I'll kind of piggyback off what Drew is saying here. I mean, I think coming off that framework, and then also two other important aspects of PAD care in the last 5 years is one, there was a lot of fear of healthcare systems coming out of COVID, fear of going back to hospitals, in particular in busy cities, resource allocation focused more on very acute hospitalized care and not more semi-acute or even chronic care like limb care. And so I think that the need for trying to reorganize how we deliver peripheral vascular care and regather all the patients and the experts and the physicians were really necessary for us to get back on track. And then we also had a challenging year last year with a lot of misinformation that came out into the lay press, a lot of confusion about where should you go to get vascular care? Should I even go? They all seem to be, doing things for the wrong reason. And so, the Sky was really important during COVID for leading a charge to get people who are having chest pain and concerns from heart attacks to still go to the hospital and still get their care. And they did a very important ground up type of endeavor to get to the patients and get in front of the stakeholders to really make a difference. And when we all looked at this past year coming out of COVID, the New York Times article, we thought this is a perfect time for Sky to be a leader in this again and take a very similar approach, grassroots approach, get to the people that matter, that are missing this information the most. So smaller communities that rely on different methods for information, like local news channels, social media, getting important leaders in the field that are not necessarily national, but local leaders, like many of the physicians people see already, and mobilizing that as a grassroots effort to improve communication and awareness. So that was really, the founding principles of how Sky and this initiative came to be.
And in one of the reasons why it was really your campaign actually came out on top was, number one, the timing, but number two, the collaborative approach at a time when the entire industry was really divided by media and maybe a couple of doctors. Here, Sky said, hey, no, on a grander level, I think we're all on the same page. Let's galvanize the entire industry, every society, bring everyone together and align our missions. And so that really led to, for people who don't understand, I mean, that is one of the reasons why the Get a Pulse on Pad campaign really bubbled to the top and earned the Best PAD Awareness Campaign of the Year award. I mean, of many reasons. So, I'm wondering from both of your perspectives, how do you think that winning the Best PAD Awareness Campaign of the Year, will align with Sky's overall mission and help you drive it further?
So I'll take that one, Kim. I think, the key thing is our Sky's mission is to save and enhance lives, right? And so I think the most important thing is that I think winning this will hopefully broadcast a message not only to patients that we're trying to do the right thing as physicians, not just as interventional cardiologists, but really as physicians, because I think some of the media was very directly and poignantly attacked at the actual practice itself. But more important, send a message to all these specialties that we are here together. And really what matters is that the patient is what matters. So it doesn't matter which specialty does your revascularization. It matters that you get in and get treated and get put on the right medications, and that for your patients that have that need revascularization, that they get that done. But the critical thing is actually just come in and realigning that trust, but also having the physician say, something, it doesn't matter who they go to. It just matters that they go to someone. And I think what this winning of this award is going to broadcast is indeed that all of us are in the right, especially, but we're also, in terms of, we're all treating PAD, but we're also trying to work together. And I think the times of turf battles and all that stuff should be laid aside. And we all need to work together to take care of the patients, because the reality situation is there are not enough of us out there. And we really need to get on the same page and working together. And kudos to SVS, SVM, SIR, and the Sky leadership, or everyone working together, try to basically come up, and OEIS to work together to try to essentially raise awareness, get the physicians working together so we can address this major issue.
Yeah, it's so important. I love that you actually targeted exactly what we need to target, which is getting those people diagnosed. The media raised awareness that maybe there was a handful of doctors that might have been, doing too many procedures, but there was no causal data that really showed that any of those procedures actually led to amputation. But yet we know that not getting diagnosed sooner is the bigger problem. With, I think, Dr. Sezemski, you put out data on LinkedIn that talked about more than 60% of all amputations, no one even tried to save the leg, and more than 90% of which never even had a proper vascular evaluation at all. So I think there's the problem, and that is why your focus of getting people diagnosed, getting people literally to get those vascular evaluations so that they can even get to the doctor sooner, so that conservative therapy is most appropriate and will stall progression, right?
No, you're spot
So
on. I mean, that's such a, and I just want to make a comment that people who live in very urban areas in the country, like me in the Northeast, there's a lot of vascular specialists in a small amount of time. That's just where training programs lead to new faculty, and then people stay around or in the region. But again, a third of the country doesn't have a vascular surgeon. And so I think 2/3, I'm sorry, of the country doesn't have vascular surgeons. So there's a lot of vascular specialists, but you go into the emergency room with a threatened limb and they don't have a vascular surgeon, they call a trauma surgeon, and then you get a major amputation on that same admission. And so, people think these numbers seem very high to not get an angiogram, but people also don't remember where they practice, as us as physicians, and what resources we may have. Or some people realize where they practice and realize the resources that are not involved, and it's a reality check. And so, I just I appreciate you bringing up that study, but you're totally right. Everything about vascular care is too late a diagnosis, too little preventative medicine, too little access with primary care doctors and other first line, clinical staff, and then us vascular specialists being available when needed, because eventually some people will need us, but maybe not as much as the current state right now.
So what aspects of the campaign do you believe contributed the most to the success of this campaign and winning the prestigious award? How about
Maybe
Dr. Klein?
Drew, you want to start?
Yeah, sure. I think that, I think the key thing, I think the biggest impact that this campaign has is targeting the vulnerable populations. I really believe that. I mean, Eric and I both practice in major cities, but I can tell you, outside at least Atlanta, not very far away, there are plenty of patients that are not getting the care that they need because of access to care and limited facilities and whatever it may be. Really a misunderstanding or lack of understanding of really what's going on. I think what this campaign does is it raises awareness, because I don't think if you ask the common, physician or even cardiologist, what do you think the difference is of PAD impact on whites versus African Americans. And if you say what percentage do you think gets more amputation, and they might get that right, but 5 times is greater, I don't think they would go that way. And so I think, really akin to some colleagues out of Harvard that did the barbershop study, really advancing awareness at a local level. I think this is a call to action for everyone, but also building trust in the community and really raising awareness in the community. And, my hat's off to everyone who's been part of this PAD campaign. It's been across specialties, really working out at the grassroots level. And I think Eric really, targeted on that. I think it's really important. This is a, uh, a coalition of the willing, as has been said about other things, to really raise awareness, take care of patients, get out there and address this before they come in, so we can kind of lead to less amputations, more awareness, people getting on the right medications so they don't have the heart attacks, they don't have the strokes, so they don't walk in disabled like Eric's patient, that they can actually have a better quality of life. And I think it's not only just quantity, but quality of life. And patients who have PAD with wounds, by the way, they have a quality of life equal that of terminal cancer. That's a pretty bad quality of life. And so I think, getting out there and addressing everyone, that's going to be important. And so I think that was the key reason. Eric?
Yeah, those are amazing comments, and I think all speak to the success of the initiative. I think I've gotten the privilege of giving a couple talks on this, and every time I give this talk, and I'll give a shout out to Gavin Stern, who's put together some amazing content as part of this campaign. He's one of the leaders at Sky. I think the content that I review is just so impressive. It goes from, again, talking about a campaign that instead of just saying we're going to take out an ad in the New York Times and respond to that New York Times article, sounded like a great, initiative at the time for some people who were looking for that. But that also speaks to a very small portion of the population who actually saw the article and reads that frequently and whatnot. This went after all these big cities with big problems, in the South, in Texas, areas where we don't get our educational materials always across, where there's language barriers, whereas there's differences in how people access information. And Sky took that to heart and developed really, speakers who are local representatives of the community. Again, getting on local media stations, engaging in social media, really stars and campaign leaders who can help spread the word through the social media initiatives, very much like what you do, Kim, with your entire program. And I think spending that effort to develop content in simple wording, not medical jargon, and provide real tips to patients, like what are the 3 big points you need to know? What are the 3 biggest risk factors for PAD? That's the heart of this campaign, because again, in Boston, I can go do a pretty good job getting to a lot of my Boston community about PAD, but there is a whole world of community that I struggle to reach outside of Boston area. They live in more remote areas. They don't have a lot of big hospitals near them. They, again, look at different materials to get healthcare information, and we gotta speak to everyone. And so I'm most proud of that part of this campaign. I think that's really what drove its success, and will continue to be a big player in how we move forward with PAD education.
Can you share any early data or feedback on how the campaign has actually impacted amputation rates or early detection of PAD? I would imagine that, with you and I know that there's been Dr. Felucio Faccarete and Dr. Anita Dua and also Dr. Klein that have all been physician spokespeople and many media outlets. Has anyone come to you and has said, "Oh my gosh, I had a patient that saw this campaign," or maybe you yourself was seen as well?
Yeah, well, I think measuring the harder outcomes will be a matter of time. These outcomes influence don't really, happen, within weeks or months. And so and it's hard to measure. So we'll see, again, what the natural course of this educational effort is. But, I could tell you, we've posted, and there's been a lot of discussion about just how has this campaign actually got to the people it's meant to get. And again, there's been, thousands of media placements, thousands of website views, and a lot of the other metrics that really show how much engagement there's been with the social media posts as well. So I think we have some really nice benchmarks. I'm sure Sky will share at some point to speak to the engagement characteristics from the
Yeah.
campaign. I think though measuring the real important stuff, which is how does this translate into better behaviors and change in practice and better care, is a charge for all of us to figure out how to measure that and to actually implement that over time.
That's amazing. Well, we had several patients that actually had seen the campaign and then did a Google search and found us. And so I appreciate you guys. We were able to
So,
facilitate getting those patients the test that they needed. And so, in fact, I was just looking over to see we actually had 17 people, I think was the latest number, because we just had one just the other day that came in, so that saw your website. So it's fantastic the impact that you guys are having. And but I'm wondering, okay, great, we reached the patients, but how does that campaign work to bridge the gap between the cardiovascular specialists and primary care physicians in PAD management? How do we get those primary care doctors, the general practitioners, the gatekeepers to actually start being proactive versus reactive?
So I'll take that one, Kim. And I think the important thing is getting our education up and out to not only within our own systems, right? So we have a 25 hospital system here at Piedmont, massive history, massive system across the state of Atlanta. In fact, it's the largest employer in Georgia. So I think getting that information out, and we use it, either via our web post, which we've had a lot of data like this at papulse.org. Also I really make a point of putting a little plug in every single one of my Epic notes. I have a little what's called dot phrase to be able to put that in. And so then when it goes back to the primary care physicians, they get an automatic hyperlink that basically brings them up to speed and brings them up to the website. And so getting that done on every single one of our patients is going to be important, and every single person involved in the campaign. So it's all about a domino effect and really getting the information out locally first, and then bringing it also nationally, and hopefully meeting somewhere in between. So again, raising awareness and targeting patients, targeting our physicians at the educational level will be important too. So hopefully, we're going to see a little bit more of this at the medical school level, and at the resident level and beyond, and really targeting that PAD is not just one specialty. It's actually very much numerous specialties, and it's something that affects all patients, and we all need to be aware of it. It's not in a little bucket over there for one specialty to deal with. So really reaching out, I think using our local systems, obviously Harvard has a number of systems, and I'm sure Eric's face has been plastered all over it. And that's important because we really need to get that awareness out and work on kind of locally attaching every hospital from the rural hospitals to the city center hospitals. So that's my take on it. That's how I think we're going to do it. Eric, what do you think?
No, I love everything you said, Drew. I mean, I think that's exactly right. I think I love your comment also about getting more education into our, medical schools and early training. I think you brought that up at the beginning about not even, really encountering PAD as part of your internal medicine training, which I feel was a very similar experience for myself. And so I think we have, as Kim said, we have problems on the outside the medical physicians and medical specialties, and then we have our own problems within our medical physicians and specialties. And so I think all this, though, is exciting. There's a lot of attention right now in PAD, finally, thanks to, again, people like Kim and Sky and others who are getting the word out, where I find that, physicians are getting excited to practice in this space, teach, learn. And I think we just have to keep that snowball effect going through all these initiatives.
So more specifically, how do you plan to build on the success of the Get a Pulse on PAD campaign in the coming years? I'm sure you have that roadmap ready to go.
Yeah, so I think the most important thing is collaborative work. So I think working together, for instance, right now we're working on appropriate use criteria as a alliance between all of our specialties to kind of make certain that we're kind of responding directly. This is within the physician area to kind of target when it's appropriate to do procedures. We're trying about doing the right procedure for the right patient at the right time. And so all of us are working together, SVS, SVM, OEIS, SIR, and Sky all together, kind of, so you're seeing this multidisciplinary societal approach. And I think what our idea here is to kind of the more people we have on board, the better off we're going to be. The only person that's going to benefit is going to be the patient. When there's infighting or disagreements, and there can be disagreements, that's fine. But if specialties are pointed against each other, the only person that's going to lose is the patient. And so I think the key thing is, in the interventional cardiology space, we take care of heart attacks. So it's really just kind of us taking care of heart attacks. PAD is really multidisciplinary and very similar to the work done in the PE consortium where pulmonary embolism is multidisciplinary. PAD is really multidisciplinary. And so I think moving education so that all of us can work together as a team, I think that's going to be the real. So there are only, 8,000 interventional cardiologists, I think, within the United States. But what if you add in all the other vascular surgeons, all the interventional radiologists, all the vascular medicine people? That's more people. And that means we're going to reach more patients. That means we're going to have a bigger impact. At the end of the day, that's what matters, having a bigger impact on this disease and optimizing the patient outcomes and their care.
Fantastic. I want to open it up. We are getting in a few questions from our studio audience. Douglas, go ahead and unmute and ask Dr. Sezemski and Dr. Klein your questions.
We're talking about walking. I get a lot of this. Is there a big difference between walking on the treadmill and walking on the street? And the importance of walking properly is another one we get a lot. But I think right now, a lot of the questions we get is people have trouble walking on the street, but they do better on the treadmill, or they do better on the treadmill than on the street. Does that make sense?
Absolutely, Douglas. Absolutely. I think, if you look at the original study about exercise, it was done on a treadmill. And, at the end of the day, the treadmill is nice because it's flat and you can make it hilly if you want to. Here in Georgia, there's nothing that's flat. And so the real exercise therapy that people talk about was based off a study from almost 20 something years ago, where you walk fast enough to get pain within a few minutes. And whatever speed that is, it's a lot easier to do that on the treadmill. And then you stop and you rest and then you walk again till you get the pain within 3 to 5 minutes. And you alternate back and forth till you hit 30 minutes. And then, you do that 3 to 5 times per week. I promise you'll feel better. You add 5 minutes every week until you get to a total of 60 minutes. Promise you will do better. The problem is, unfortunately, not many people are doing that walking therapy. And it's also great for your heart. And I applaud you for bringing up the walking therapy because it really makes a difference. As per, can you do it on the street or can you do it on the treadmill? I like the treadmill personally because the weather's not an issue. Obviously, down there in Texas, it gets pretty hot. Up here in Atlanta, it gets pretty hot too. And hills and weather and all the other features. So really, it's whatever you want to do. Personally, I find sometimes walking the treadmill a little boring. But if you can, it seems to be a more controlled system. But if you feel like you want to walk on the street, just get out there and walk. I don't care wherever you do it. It's going to be good for you.
Do you ever see, including walking as being the best medicine for prevention as part of the Get a Pulse on Pad campaign?
Eric, what do you think?
No, it sounds
I
like
see Eric smiling. We're hitting his favorite topic.
No, I think it's a smart thing. The couple of extensions of PAD, the Pulse campaign from here was, one, to do more advocacy, but also two is to develop patient-centered tools. We call it shared decision making because we lack a lot of this. And like Drew said, there are a lot of patients, and actually, as brought up, Kim, by you at the beginning of the call, there's a lot of patients that would have done really well with exercise therapy and weren't offered it or wasn't discussed enough or wasn't considered. And so better incorporation into the alliance on building out some initiatives on exercise therapy would be fantastic. And then also making sure that we have the tools to fully educate patients on the array of treatment options that are out there outside of maybe you got no options or you have a big procedure. There's a lot in between there that gets lost sometimes.
Yeah. Marcia, do you have a question? Go ahead and unmute and ask Dr. Klein and Dr. Sezemski your question. I think she is having trouble unmuting. Okay, well, she doesn't have a couple questions. We'll see. I have a couple last questions, though, before I let you go. I know time is a bit of the essence here. We ask this of all of our doctors. I want you to share 6 minutes that mattered in your career. It has to be a defining moment, a catalyst for change, a spark that led you in a specific direction. It could be a conversation you had with someone. It could have been a scene in a show or a movie or a documentary, something that you might have witnessed that's eye-opening. What was that defining moment in your career, those 6 minutes that mattered?
Go ahead, Eric.
All right, 6 minutes matter for me. And again, I think I could probably give you a dozen 6 minute moments that mattered, but the 6 minutes that mattered comes to mind. The first is I was finishing my cardiology training at the Massachusetts General Hospital, and how the program worked from there is you say, I want to do interventional cardiology, you apply. I applied and got into interventional cardiology. And during interventional cardiology training, most programs in the country, they only teach you how to do coronary procedures. So just heart attacks and those type of procedures. Some, but not all, will incorporate maybe some of the peripheral vascular stuff or the valve stuff now. So I'm doing that program, and then you have a choice. You can you can stop there and go practice. You can do another year of training in structural heart. So that's with the valves. Or you could do a training year with vascular disease. And at the time of my training, the structural heart disease, all the valve interventions were becoming really popular. Everybody wanted these programs. They're very coveted. We had a great program at Mass General. And they came to me and said, what do you want to do? You can have your pick. You can do structural or you can do vascular. And like Drew said, I spent a little time doing vascular. I didn't know it as well as I should have probably if I had gotten more concentrated training. And my 6 minute call was to my dad, who was a community cardiologist out in northwest suburbs of Chicago. His partner, who's from Poland, came here to Massachusetts, did some training, and then went to practice with my dad in Chicago. And he called me and he said, listen, you're at Mass General. You have Kenny Rosenfield in that lab. Everybody in the world knows who Kenny is. Why would you pass up the opportunity to train with one of the experts in the field in the most important disease states that are out there? And I had my document for structural heart signed, and I looked back and I'd spent a couple extra days with Kenny in the lab doing some procedures. I looked at the academic potentials and research that I can do in this space that can make a difference. And so I tore up the structural one, decided I was going to do only vascular for my career. And so that 6 minute call from not my dad, who I love and gave me a lot of great advice over the year, but his partner pushed me into where I am now, which I'm incredibly thankful of because, it opened up a lot of really great opportunities for me in my career and make a difference to my patients.
Well, we're thankful you did. You are having a huge impact. So right decision, right decision. How about you, Dr. Klein?
Yeah, I know. I'm going to echo sort of similar. It wasn't patience. It's all about your mentors. And so I remember sitting as a first-year fellow at the University of Colorado, and we had one of our new attendings, Ivan Casterly, was from Ireland, and he came over and he gave this talk on superficial femoral artery disease. He was just starting as a new attending, and I kept thinking in the audience, why do I even care about this? I'm a cardiologist. Why is this guy talking about this? I don't understand. And it was working with him over the next several years that really developed my interest in it and really my passion for it, and to go on and do interventional cardiology with a vascular medicine focus. And he had trained at Cleveland Clinic and really brought that knowledge forward. And I think, it's all about, it was all about Ivan and his influence on me. And I think it's really important that we all understand that if you have that mentorship, and so just for Eric and I, as we mentor people, you can have a huge influence on people. Just a certain twist, a moment, a passing comment. These all make big differences and things that you don't even think about. And so I was sitting in that lecture hall wondering why I was listening to this, and then later on to do research in that area, and then later on to practice in this area, that really turned it for me. And I think it's so important that all of us physicians, as we interact with our junior mentees, that we take each interaction and be mindful of what we're saying, because it may make a big influence, just a passing comment. And it's so amazing to me how that can make a difference in your career. In fact, another 2 minutes was a guy that stopped me in the cafeteria as a third-year medical student, asked what I wanted to do, and I said I wanted to be a surgeon. He said, no, you don't. You want to be an interventional cardiologist. So you can see that father of five, the father of three that has this MI and comes in, and you can see them every day, fix them, get their artery opened up, and then see them and their family for the rest of your life. And I sent him a message recently and said, by the way, Kevin Casper's his name, from Philadelphia. And I said, Kevin, I not only have one, but I have several patients that I see that, had that opportunity to make an impact. And, when you make that change, it was just a comment like that. It was an influence like that. That made the difference. And then going on to work with Ivan really made the turn from really focusing on coronaries over to vasculars. So it's a pleasure too, because it's a really fun group of people, Kim. If you haven't gathered that, the interventional cardiologists that focus on vascular disease, like Eric and Jake Geary and Kenny, and it's a small group, but just amazingly fun people to work out with. And we all have the same passion. We all have our same love for our patients and for this disease subset. And so that's what my 6 minutes, and it's we're just going to keep on trucking and hopefully get more people to have those 6 minutes by influencing younger colleagues.
Thank you. No, oh my gosh, very powerful. I have one more deep question, and then I'm going to ask you how everyone can get involved to help you guys with Get a Pulse on PAD. But I want you to share a case with a big lesson for you or for others. Describe the patient, a little bit of frustration you had with the case, and then the lesson that you learned, and others can learn from it. It could be a success, it could be a failure, it could include a little ingenuity. But what was a case in which there was a big lesson? Not that there aren't many, but what's that one that stands out?
Eric.
So
Boy, you're putting it on Eric so you can have some thinking time.
No.
I'm
So Eric and I spent enough time together that I went last, so he gets to go next.
I'm always ready with an answer, for better or worse.
Yes.
So I have, I think about this patient a lot still. I had a patient in a very underserved community. She had a minority background. She was still working well into her early 70s, working regularly. And she was, matriarch for her household. She was she was helping support her children and grandchildren. She had a really independent, successful career, but she had a lot of accumulating risk factors. And it was a real challenge because she had to commit so much of her life and time to her family and to her work, which was very important for her family still, that she was letting these really important risk factors slip. She had really advanced diabetes that had been unmanaged for a long time. Her kidney function was starting really to progressively fail. And, it was one of those stories where every time I saw her, we sat down and we had a heart to heart that, we're moving in the wrong direction, and we got to figure out how to get you, some more healthcare help to get control of these major comorbidities. And she developed a wound on her toe, which we kind of knew was coming. We revascularized her. 6 months later, the wound reappeared after it healed. We revascularized her again, and it became this cycle just of, a little bit of just, watching a close family or friends kind of pathway kind of slip away. Soon her kidney function failed enough that she had to go on dialysis. She had some heart failure symptoms. I spent a lot of time with her family. I'd see her at least twice a month, if not more. And, in the end, we were able to save her limb. We were able to get a lot of her comorbidities under control. But, she still was just left with this, part of her life where she should be celebrating all the success of building a family and supporting a family, and is distracted by all these mounting healthcare concerns. And so, I think that the learning part of this was important to me because, we as physicians are, unfortunately, it's like, you go to a farm and you watch the chickens walk around, and it's hard to pay attention to individual chickens because there's just so many chickens coming through the door. Like, we just get stuck in this world that a patient is a 15-minute visit, and if needed, a phone call later. And this was one where you can tell that this patient could have benefited from some real dedicated healthcare specialists that branch all specialties, not just, an interventional cardiologist or vascular specialist, but herding other specialties together, communicating. It just showed you where our system continues to let us down. And so I think about that a lot, and a lot of the stuff that we've been working on recently. And, I have guilt about the fact that we're really good at naming and pointing out problems, and we're not as good at actually offering solutions for those problems. And this patient always reminds me why we need to extend what we're doing to that next step. which is get into that patient's back, into their neighborhood and make a difference, not just, write a paper and publish it in a journal. And so anyways, I think about that patient a lot. And I think for me, it was really good training in the social areas of medicine that we don't get enough background in medical school. And I appreciate you asking for me to share that.
Yeah, no, I appreciate it. That's why the Get a Pulse on Pad campaign and your involvement is so powerful. You're actually doing something about it, not just talking about it anymore and complaining about it. And Dr. Klein, what's your case?
Yeah, I know. So I think, my case involves more of a cross linking or a cross specialty in terms of cardiovascular. So I have a patient that worked for CNN for a long time, and I've been seeing him from a cardiovascular perspective for a long, long time. And unfortunately, he had a very big event cardiovascularly, ended up coming down to Piedmont, Atlanta, sick as we've ever seen, on life support, ECMO. He had longstanding diabetes, terrible cardiovascular disease, and everyone was focused on the cardiovascular disease and getting his heart stabilized. But in the meantime, while he was laying in bed for 4 weeks on an ECMO circuit, he developed non-healing wounds on his heels because he basically had pressure wounds, which are not uncommon. But in the setting of diabetes, they can have severe peripheral arterial disease too. And even though I hadn't seen him for peripheral arterial disease because he had never really had any issues, this became a big barrier to him even moving to the next step, which was getting an assist device and then hopefully getting on the transplant. He had bilateral heel wounds. While on ECMO, we did intervention to his legs to kind of improve that. He was an acute kidney injury. I mean, this person is, amazing because he had donated a kidney to his brother, so he's only working with one kidney. Everything was in a bad situation. Everyone thought we should just move towards hospice, and he's only maybe 60 years old. But we were able to revascularize his leg, get his heels wound, get him rehab. He went on to receive an LVAD. And now he's approaching the point where he's going to be listed for a heart transplant. So it was really working. His family is, again, like Eric said, working closely with the family. And really, it was a nice crossover between being an interventional cardiologist taking care of his heart and being a vascular specialist to help the same patient and really getting involved. And so it was through that interaction. He also had a acute limb ischemia from access. It was quite frankly a disaster. But he kept his positivity. He kept going. He wanted to keep living, and we all kept cheering for him. And thankfully, he's doing quite well today, and he's on his LVAD, and we're looking forward to he's walking. Every time he comes in, I take a picture of him walking so that I can send it to my surgeons, say he's ready for transplant. So feel free to list him, guys. And I think we're working on that this month. So he's really taught me a ton about how you really need to be aware of all systems and really treat the whole patient, not just one area. And how working together in multidisciplinary teams really makes a big difference for the patients.
Wow, thank you for sharing. And I mean, I'm just listening to the stories, it gives me hope. It gives so many patients hope that there are amazing doctors like you that are taking that holistic approach and really do care about the patients personally and realize that patients are people. They're human and they have families, they have friends, they have, dreams, and you really listen to them. So we really do appreciate that. Thank you so much from the bottom of my heart for all both of you do. How can we get involved to help you? How can patients get involved? How can anyone who's tuning in right now get involved to help you with the Get a Pulse on Pad campaign?
So I think it's really just, being spokespeople, getting out there and talking to people and raising awareness at the local level. So if you're someone who has peripheral arterial disease and you're someone who has diabetes or end-stage renal disease or high blood pressure, being aware, first of all, in your own self, is there something going on? Am I getting a wound here? Is that an issue? But if you're fortunate enough to have been involved with vascular specialists, and hopefully you are because that's why you're on this call, but really reaching out at the grassroots level. And so if you're in church, we have so many patients that say, "Oh, I got your number, and I learned about you from my colleague at church," or community wise, be it just being aware and really talking to everyone around you and talking about it is going to be important because if one person makes a little bit of difference, 10 people, it's tenfold, and so on and so on. So, and then of course, reaching out and broadcasting not only social media for those people who do that, but a lot of our patients honestly or older, they may not be on social media. So that's okay. So Facebook is a big issue for amongst a lot of patients. If it's not Facebook, then just saying, hey, here's a website. Why don't you go look at this? And here's some other things that you can do to kind of help raise awareness and be active and get involved in your local society, your community, and really spreading that knowledge across everyone that you have impact with. That is how you do it. It's, again, grassroots, one person at a time.
Yeah, definitely. Well, a big thank you to you both. Dr. Sezemski, anything to add to that? Maybe even we should bring in Gavin Stern just to give him a big shout out right there. He and his team at Sky have played an integral role really in doing this. Gavin, unmute for 1 second and just say hello and give a shout out to your team and all the effort that they've all put into this Get a Pulse on PAD campaign and the impact that they've had.
Oh, thanks so much. Get Up Pulse on PAD campaign is an effort from obviously our physicians, both associated with Sky and with our partner societies as well, and a whole team here at Sky who's been involved in the graphics and the copy and the social media promotion. So it's a big team effort. But we're just happy to be getting the word out there and hoping to make a difference.
No, we appreciate you and all you do. Any final words, Dr. Sezemski?
No, sorry, I had an internet glitch for a minute, but no, I think Drew really summarized this nicely of, I think the role of our patients right now, and in particular, everyone on this call and who will see this video is to be a local ambassador. You know what I mean? We just need to get the word out, and this initiative is going to help, but it only helps with us planting seeds for, on the ground to then spread the word to, your local communities, wherever you are gathering, wherever you are socializing, and making sure that we have. And then, Kim, continuing your efforts to really align physicians with patients and patients with physicians so that when there is a concern, there is a gap in vascular care, that we can solve that gap. And you have a great opportunity and ability to do that already. And so anyways, I think everything we're doing here is exactly what we need. And I'm so proud to be a part of it. And I'm so thankful to Kim and everyone else that you have interest in this as well and are helping spread the word and make a difference. So thank you.
A big congratulations to all of you and your team and all of the partners that are involved, all of the different societies involved in the Get a Pulse on PAD campaign through the Global PAD Impact Awards. They have been deemed the best PAD awareness campaign for 2024. Congratulations, and a big thank you to Dr. Andrew Klein from the Piedmont Heart Institute, specializing, of course, in the interventional cardiology, vascular, endovascular medicine, and Dr. Eric Sezemski, the Director of Vascular Intervention, and at Beth Israel Deaconess Medical Center, also Associate Professor of Medicine at Harvard Medical School. We really appreciate you both being here. A thank you to Gavin and your team. And again, a big